Hi, Facebook friends. Helen Arcantu here, CEO of the YWCA of Northern New Jersey. So happy to have some time with you today on this Wednesday afternoon. We hope you're having a wonderful day, and we're so excited to have some time with you to obviously share some information. As you know, YWTV is all about educating you and inspiring you. And today we have a wonderful conversation for you that is very important for our community. We're so glad to have with us Brianna Greenberg, who is the Care Coordination for Jersey Assistance Community Giving Program. Well, let me see. She is the, well, let me say that over again. Care Coordinator for the Jersey Assistance Community Caregiving Program. That's part of the Bergen County Division of Senior Services. Did I get that right, Brianna?
Yeah.
So we're so happy to have her here to talk with us about the evolving needs of seniors in our community, and also, you know, how our seniors and our older adults have fared during these last few months with the COVID experience. So for those of you that don't know, in Bergen County alone, we have over 190,000 older adults, which is an amazing number. And we know that number is, you know, definitely on the rise. So let me tell you a little bit about Brianna's backgrounds before we jump into our conversation. She has had the pleasure of working with the health and human services field for 19 years, and she's worked in a variety of settings, including group homes, nursing homes, and adult daycare, and on different ways, but always serving the community in some way. Her roles have ranged from a residential therapist to a recreational therapist to care management. She currently, as I shared, is working for the Bergen County Division of Senior Services as the care coordinator for their Jersey Assistance Community Caregiving Program. And one of her favorite parts of her job that she shared with us is educating the older adult community and the professionals who work with them about resources that are available. So we're so happy to have you here, and it sounds like we're going to have some time today to do what you love best.
Thank you.
So tell us, Brianna, with so many seniors living here in Bergen County, I'm sure that their needs are diverse and changing, since we know that our senior population is changing, and their abilities and capabilities have really shifted significantly over the last decade. Really, we've seen a real change in this work. So we know some are living independently and others are getting more care from their family. Can you talk to us a little bit about that, and also what caregiving looks like in Bergen County?
Sure. So most of us, thank you, of course, for having me. Most of us want to age in place. We don't want to go to an institution, but we are finding as we're getting older and our needs are increasing that staying home means that we're going to need more support. So this means particularly from family and friends, and even neighbors have stepped up to make sure that people are getting the care they need to stay in the community, both safely and strongly. We have approximately about 100,000 caregivers in Bergen County. And according to AARP, they're averaging about 15 hours a week of caregiving. Unpaid caregiving is estimated to be almost $1 billion in Bergen County alone. And what they're providing is, and caregiving has a broad spectrum. You've got the caregiving of the daughter who lives in Washington State, who's calling in ShopRite to have, groceries delivered to mom and dad. And then you have the caregiver who's sleeping in the same bed with their family member who has Alzheimer's, because it's so difficult for them to not be around them 100%. So usually caregivers are, they're doing home care, they're making meals, they're doing grocery shopping, they're doing house cleaning, they're the extra ears in the doctor's appointment. How many of us would enjoy having just one set of extra ears in the doctor's appointment? They're managing money, they're managing medication. And what we're finding is when you can add just that plus a little home care, we can usually keep folks in the community for just a little longer before we have to move on to another step. And we're fortunate in Bergen County that we do have a handful of home care programs. My program, the JAC program, Jersey Assistance for Community Caregiving, is a program. We have the respite program, a homemaker program with the Board of Social Services. And of course, then there's the Medicaid programs as well to help supplement the caregivers.
Well, I can personally attest to this caregiving need. I care for my 89-year-old mother, and I've been caring for her for years. And my father, well, he was alive as well, but moved her in with me when the pandemic started a few months ago, just because she definitely needed that level of care. So I'm curious. I mean, that's my experience, obviously. How's caregiving changed for others during this time with the pandemic?
Well, I will tell you this. This is a difficult time for families and the ones who are caregiving. As I'm sure many of you who are aware, who are working with folks in the community, when we take away socialization, our medical needs increase. Our memory impairment increases, our neediness increases. And while a lot of family members sadly are out of work right now, or for those of us who are working at home, it's now coming upon these family members to step up to this, even through their own stress. On top of which, caregiving in the pandemic has put a new ball game out there, which is, I don't want my aide to come to the house right now. I don't want to be exposed. They may have been getting 40 hours of home care from an aide, and now they're getting none, which puts all the stress on the family who might already be taking care of their own children, their spouse, their neighbor. Maybe they're just still working 40 hours a week and they still have to go in. A lot of us are still going into the office. So because we're trying to limit the exposure and keeping it to family instead, and a lot of services are virtual, the emotional stress and anxiety during this time has increased exponentially. And sadly, we're noticing a very large increase in abuse and neglect among our folks, because a lot of things we're not taught when we start taking care of our loved ones. And one of them is how to manage stress when you're working with your family. And I'm sure we can all attest, family push our buttons. They're the ones who put them there, and they're the ones who know how to push them. And some of us never really learned how to deal with that. So now they're dealing with Alzheimer's, dementia, or Parkinson's, or multiple sclerosis, or just someone who's aging normally and never really changed, but's more needy than before. So we're noticing that the pandemic is exacerbating some of the negative sides of caregiving.
So during this time when we're seeing that, what are some of the supports and resources that we can be recommending for family members that are, struggling with these challenges right now?
Sure. So I would highly encourage you, to call our office. We're the Division of Senior Services in Bergen County. We have an information and assistance unit that can discuss with you ways. We have a caregiver education program through our respite program that will do mental health. They'll teach people occupational therapy, physical therapy. There's also support groups that we help facilitate. We have our respite program itself. So if you are the caregiver and you qualify, we might be able to pay you to be the caregiver, which means it takes a little financial stress off of you, especially if you're not working. Mm-hmm. There's the homemaker program, again, if they're willing to take aides in the house, or maybe you just need something as simple as Meals on Wheels or delivered grocery services just to take you back a little bit. There might be a lot of financial strain. If you call us, we'll do a benefits checkup and find out what else you qualify for. So maybe we can take the strain off the back burner so that the strain you're feeling with is just a little bit less than what you would normally feel.
Well, that's wonderful information. And it sounds like there are definitely a whole host of resources that are accessible if you just know where to call and where to go. We will make sure we put the phone number and the website in the comments for this event that we're YWTV right now in our comments in our broadcast. And that way anyone watching can easily access it sounds like the analysis and assessment, which is the first place to start, getting to someone on the phone and getting an assessment. And then from there, hopefully getting connected to the appropriate services. That's wonderful to know that that exists. And as I said, speaking from someone who, is living it, it's definitely a stressful experience, but it's wonderful to know that there's resources out there to support folks. So a question for you. A lot of lower income older adults, I'm guessing, especially right now, are lacking healthy food and adequate nutrition on a daily basis. And, I know you referenced some programs that exist, but obviously because of social distancing and the virus and everything that's been going on, it may be keeping people from accessing group meals at senior centers or, other opportunities how they were getting their funds in the past. What are you seeing in terms of the statistics of food insecurity that have, that's occurred during this time? And again, how are you recommending that individuals and caregivers implement some support for that?
Yeah, it is increased exponentially. Our Meals on Wheels in Bergen County, there are 3 Meals on Wheels in Bergen County that I know of. We've got our Pascack Valley Meals on Wheels, our Kosher Meals on Wheels, and then our Meals on Wheels through the county. And prior to the pandemic, we were delivering 30,000 meals.
Wow.
During the pandemic, that has increased exponentially. So what we've been doing is doing a 1-week delivery of frozen meals, but we found that some folks don't have access to a microwave. So we've been working with the organization Heightened Independence in Progress, and they've been assisting us in getting folks microwaves to at least get them the one meal. Because like you said, folks they're not able to go to the congregate meals in the senior centers. So we still need to be able to get them food. And a lot of our folks, what we've noticed is the folks coming on Meals on Wheels were not necessarily eligible prior to the pandemic, but now they're homebound. They don't want to go out. They're a high risk group. So we are trying not just to hook them up with the Meals on Wheels program, but also with grocery delivery. So one of the agents we've been using, many of the municipalities stepped up for that. And the prosecutor's office and sheriff's office have stepped up for that one as well, for your high need folks, your crazy dietary folks that we just can't pull off in another way. We've been using a private organization called Ask Umbrella. They're a private organization that does in fact have a yearly membership fee, but they were waiving it. So it's about $10 to have a volunteer do some grocery shopping. And they added thousands of volunteers because of the influx of folks needing food during this time. We've also have our senior centers still active in the role of making sure food is getting distributed. And the food banks, we were constantly in touch with food banks to see who was open, who's giving out food. And we're fortunate in that food stamps, they increased the amount of food stamps. It just took them a minute before we found that there were organizations that were willing to take it for online shopping. So Amazon was one of the ones that allowed for online shopping. So we have also, it's been interesting. Anyone on our Meals on Wheels program is pretty much going to have a phone call once a week, just because we're going to call them before we deliver, but they might be on another program of ours. So we're in contact with them regularly to see if maybe they need a shelf-stable box of meals versus just the frozen meals. So it's been, that one came at us hard and fast in the beginning, and Meals on Wheels stepped up to that. And I can't speak more highly of them for pulling that off.
Well, I have to echo, what an amazing service. And when you think about essential services that have been a force during this time and such a need, and I have seen so many volunteers step up to join these organizations to help. And definitely a shout out to the prosecutor's office in Bergen County and the sheriff's department. They really have helped fill in and be an extra set of hands throughout the community to be able to support everyone, but especially seniors. I've seen that as well. So thank you so much. This was so much important information for anyone watching. If you are thinking that there was someone in your life that should have seen this because they could benefit from this information, don't despair. This will live on our Facebook page, and you can watch it and share it with anyone that you think would benefit from knowing this information. We have in the comments, Camille Iannacone Monroe has put her email here that she is a resource for home healthcare. I don't know if she's a private facility, but we will put our facilities in here, specifically our link for the Bergen County Senior Services Program, as well as the phone numbers for those that would be the direct contacts to do these assessments. Again, it's important. There's a lot of private services out there for sure, but it's important for people to reach out to the county programs, because these services, especially for those that are, in financial need, these services are, able to, be sometimes subsidized and help support. So tell us, is there any other way, Brianna, that, before we close out, that you want those watching to be thinking about how to support those that we're trying to keep aging, in their homes, and caregivers during this time?
Absolutely. And just in general, there are a lot of ways to volunteer your time. You can do friendly phone calls. You can go shopping for folks. When this ends, you might want to do friendly visitors. But also there's donations. We need protective underwear for folks. That stuff is very expensive. So generally just volunteering the time, staying up and being an advocate for older adults. The fall is coming up. We need folks who are going to do some leaf raking or taking the garbage out, or this winter is a terrible time for us as well. We need people whose driveways are shoveled and walkways are shoveled. I mean, there's just a ton of ways to volunteer, and the Bergen Volunteer Center is a great way to give them a buzz. They've got a couple of services that you can volunteer through, and they're still there. They're not sending people out right now, but a lot of towns, I would call you municipality, you may have a friendly phone call program where you can call the seniors and help combat the social isolation that is out there.
Well, thank you so much for making so many wonderful recommendations, Brianna. I really appreciate your time. And again, this was so much valuable information for our community. I also want to take the opportunity to share that the YWCA of Northern New Jersey has a longstanding partnership with the Bergen County Department of Senior Services. We provide fitness classes in many of the senior centers across the county. And over the last few months, I really want to applaud the county and also Community Chest of Englewood, who have come together to help fund YWCA of Northern New Jersey providing these fitness classes virtually. And so seniors in Bergen County can now access these opportunities by going to our website, and there's a link there that you can register with, and you will be sent a Zoom link so that you can, right in the comfort of your own home, take your classes. And actually, we're putting the link right here in the comments, and we'll be doing another YWTV episode in the near future to be able to showcase that partnership and that opportunity for seniors. But, we know that the social isolation and the, staying home, really limits people's activity levels. But this is a wonderful opportunity to be connected to others if you're physically able to participate. So we do encourage you to reach out and look into that as well. So with that, one more special announcement before I tell you what's coming on tomorrow's YWTV. Another great announcement, shout out to our development team at the YWCA who arranged for this year, for the month of July, we will receive a $1 donation from every purchase of the $2.50 reusable bag at Stop and Shop. So if you go to the Stop and Shop located at 665 American Legion Drive in Teaneck, and you're doing your shopping there, and you decide you want to get the reusable bag, we will get a donation for that. And so we are so excited and grateful to Stop and Shop for that partnership. And those of you that live in the area and use that Stop and Shop, please consider. It's good for the environment. It's good for the YW. Your dollars will help us continue to do our work to empower women, to work with girls and families, and to work towards racial equity. So we thank you for those of you that support that effort. And tomorrow on YWTV, we have Jillian Stallwork from Gillies Organic, which is her business, but she also has a Instagram Rockstars of Bergen show that she has been putting out recently. And so we're excited to talk to her about both her business, how she's juggling work, family, self-care during this time. So we will be talking with her tomorrow. So join me then. I believe it's at 11:30. But we'll be promoting that later today. Friday, there will be no YWTV because we will all be observing the 4th of July holiday. And we wish everyone, of course, a safe and happy one. And so with that, Brianna, thank you so much for the work you and your whole department are doing and how you're keeping our older adults in Bergen County lifted during this time. It's so wonderful and comforting to know that you guys are there and such a tremendous resource. So thank you for all you do.
Thank you, and thank you again for having me.
Of course, of course. Everyone, we wish you a great day, and we look forward to seeing you tomorrow on YWTV. Take care. Bye-bye.